All right, in this part of the learning plan, we're going to talk about antiemetics. In fact, this time it'll be 2 antiemetics. There'll be more antiemetics in the next section. The 2 antiemetics for this section will be the 5 HT3 antagonists and the pheothiazines. Now, first off, let's just talk about antiemetics first. These are drugs that are used to prevent nausea and vomiting. They're used for after surgery. A person who has chronic pain or even acute pain, motion sickness, cancer, chemotherapy, radiation therapy. Vomiting occurs when the vomiting center, which is in the medulla oblongata, is stimulated. Stimuli may come from gastric mucosa, intestines, joints, peritoneum, the cerebral cortex, vestibular apparatus of the ear, neurons in the fourth ventricle. So many things can trigger vomiting. Most antiemetics will cause some level of sedation. And several types of receptors are involved in the vomiting response: serotonin, dopamine, acetylcholine, and histamine. And antiemetics are contraindicated when their use might prevent or delay diagnosis, or they mask signs and symptoms of drug toxicity. So, if a person is vomiting or they're nauseated, before we treat them, we need to know what's wrong, because that will help us guide the type of treatment and what may be the underlying cause. Why do we want to treat nausea and vomiting? Once we know the cause, why is that important? I mean, first off, it can cause fluid volume deficits. It can cause imbalance in nutrition, risk for injury, ineffective management of therapeutic regime. If your medication is making you vomit, you're probably going to consider not taking it. You may aspirate, which can be fatal, and you're miserable. So we try to prevent this whenever possible. We're going to talk about herbal and dietary supplements. When you look at the PowerPoint, click on the ginger and the peppermint links to see if herbal and dietary supplements are effective. Now, there are many categories of antiemetics, and we'll talk about each of these in turn. Motion sickness is treated one way: anticholinergics and antihistamines. Chemotherapy is pheothiazines, corticosteroids, serotonin receptor blockers. Every cause has a best possible treatment. That's why you need to know what's causing the nausea and vomiting before you start treating it. So let's look at 2 categories: the 5-hydroxytryptamine 3, or the 5-HT3, or serotonin receptor antagonists. The 2 most common is ondansetron and granisetron. Ondansetron, granisetron. Those are the generics. And remember, generics are what you will see on your NCLEX. These relieve nausea and vomiting, but they block serotonin receptors and that reduces nausea. This is an excellent choice if you have nausea and vomiting due to chemotherapy or radiation therapy or postoperative nausea. In fact, for postoperative nausea, this is the first drug of choice. When you're on the med-surg units, you will be giving a lot of ondansetron. This can be given orally or IV. And the safety and efficacy has not been established for children younger than 3. So you won't be giving this to children, likely. If it's combined with dexamethasone, it's even more effective. But very common, you'll give this IV push, 2 to 4 milligrams, sometimes 8 milligrams, and this produces great relief in your patients. Side effects: diarrhea. If you're looking at GI medications, you're going to look at a lot of GI side effects. So diarrhea and constipation, along with headache and dizziness, muscle aches, fatigues. It can maybe cause transient elevation of liver enzymes. This drug has less sedation than most, so it's very useful, especially if a person who's post-operative and using pain medicine. You don't want to give something that's going to cause additional sedation. This could possibly cause extrapyramidal symptoms, and it is the best choice for post-operative nausea and chemotherapy nausea. Pheothiazines. Chlorpromazine is a common one. Prochlorperazine is another common one, and promethazine. Azines, phenothiazines, azines. Remember that, azines. These block dopamine from the receptor site. They're used for nausea and vomiting due to drugs, radiation therapy, surgery, nausea caused by opioids. Also, nausea that's caused by vestibular infection and inflammation. This classification is also a psychotropic medication. They're given in much smaller doses for antiemetic properties. They do have anticholinergic effects, dry mouth, blurred vision, tachycardia, constipation, and urinary retention, but they're not actually anticholinergics. They also have some antihistamine effects. They can cause hypotension. They might cause extrapyramidal symptoms. They could cause restlessness and weakness. Do not take with alcohol or narcotics. Thorazine, the chlorpromazine, that's used for hiccups. And we talked about that in the nervous system, the mental health learning plan. Side effects, they have antihistamine and anticholinergic side effects. So again, sedation, cognitive impairment, possibly extrapyramidal reactions, hypotension, those are the antihistamine. Anticholinergic, once again, dry mouth, tachycardia, constipation, urinary retention, blurred vision. These are usually used when other antiemetic drugs are ineffective or only a few doses might be needed. Phenothiazines other than promethazine usually should not be used in young, elderly, pregnant, or post-operative clients unless the vomiting is severe and cannot be controlled with other measures. So you won't use these as often, but you will see these used, and they work. Come back in the next section, we will finish off the antiemetic medications.